Vaccination policy no longer outweigh the costs. This policy most certainly has run its course. So it's time for us to take a step back in living with COVID and to make every effort to get our lives back to normal. It's time for us also to heal the divisions in our communities over vaccination. Those divisions are in our families, they're in our communities, but they are across our province and they're across this nation. It's time for us to come together as families, as friends, as communities, and as a province and as a nation, and it's time for us to reach out and support one another. Let's not judge our neighbor because they may be vaccinated or because they may not be vaccinated. Let's not judge our neighbor if they should choose to wear a mask or not to choose to wear a mask in the weeks ahead. Whenever someone is doing their own personal risk assessment, which we have asked them to do in this province for a period of time now, they're doing that assessment for themselves, possibly for their family, and they may come back with a different decision than what you might arrive at. And that different conclusion, albeit maybe different from where you have landed, should not be judged. It should be respected and it should be accepted. It's time for each of us as individuals now to make a conscious effort to treat everyone in our daily lives that we encounter equally. It's also time for the proof of vaccination mandate to end. So effective at midnight this Sunday, February the 13th, all provincial proof of vaccination requirements will end. In Saskatchewan businesses, in venues and provincially regulated workplaces, this means that the proof of vaccination or the negative test option that we had provided will no longer be a provincial requirement. Starting on Valentine's Day, February the 14th, this will be the case. This will leave one remaining COVID measure in place, and that is indoor masking. That measure remains in effect until the end of February. I want to thank all of the businesses and the venues and the workplaces who have shifted course throughout this pandemic to keep their employees and to keep their customers safe, and all of those who implemented and administered the proof of vaccination or proof of negative test policy over the course of the past few months. Thank you for doing your part in our fight against COVID. And again, I want to thank everyone who made this choice. It is a wise choice to ultimately go out and get vaccinated. You are keeping yourself safe. As we move into this next phase, the phase of now living with COVID, I would ask you to continue to make wise choices. This is paramount to our success. Go get your booster dose if you haven't already. Stay home if you're not feeling well. Do a rapid test from time to time. If you do test positive, we want you to stay at home for 5 days. But let's all, in the meantime, also get back to living our lives normally and doing the things that we all love to do. And let's all make that extra effort to be just a little more understanding of others when we may disagree. In fact, this may well be our largest challenge in getting our lives back to normal in our families, in our communities, in our friendship groups, and in our province. We must realize that it's okay for us to disagree. We do hold strong opinions in this province, and those are on full display often. But we can disagree without being disagreeable. Don't lose a friend to COVID. You might have to take some time apart, but keep that door open. Time and time again, Saskatchewan people have proven that we achieve great things when we come together and when we work together, and when we accept those who may have a different opinion than we do, and when we respect others' individual decisions. We are poised to lead this nation through COVID, and we are poised to lead the world in an economic recovery in this province. So let's work together. Let's work together to heal some of the divisions. Let's understand that we can forgive our friends, our family members, maybe even ourselves, if that is necessary. Let's work to heal those divisions. Let's come together and let's once again be ourselves in our communities. This is a great province. This is a united province. But most importantly, this is a tolerant province, and we are going to need all of that tolerance in the days ahead. It's time for us to move. Thank you. Dr. Shahab, do you have some comments?
Thank you, Premier. I'll just clarify a few things. Obviously vaccines remain available, 5 to 11 first, second doses, additional doses as required for severely immune compromised. 12 and older, as announced today, booster doses are available. For 12 to 17, they are available 5 months after the second dose. So most 12 to 17-year-olds got this second dose July, August, so there shouldn't be any problem accessing that. It's just a reminder here that the online booking now is defaulting to 5 months. So if anyone 18 and older wants a booster before 5 months, they can call SaskVax 1-833-727-5829 to get a booster. If you're 18 and older after 3 months, but 12 to 17, they can get a booster after 5 months. However, 12 to 17-year-olds who are severely immunocompromised have been eligible earlier for a booster at 3 months, and they will continue to be so. I think that is all just a reminder that outbreaks will publicly be reported only in long-term care homes and personal care homes, similar to other respiratory outbreaks. And public health will continue to investigate in those high-risk settings, including personal care homes, shelters, and group homes. And just a reminder that Thursdays is when the weekly dashboard, as we discussed last Thursday, will be posted for a summary of case numbers and trends over the last 7 days. But that will be up till Sunday of the previous week. So it'll be a weekly epidemiological survey summary posted every Thursday. Thank you.
Thank you, Premier. Thank you, Dr. Shahab. We'll now move to questions, starting in the room. We'll start with Larissa. Do you have a question?
Sure. So as far as I'm aware, this morning, Saskatchewan is the first province to remove this proof of vax policy here. Why is it that you think that the province is ready for that, and why should we be the first province to do that?
Well, we're not removing it today. It'll be removed at midnight this Sunday. We're the first province, yes, to announce that we'll be moving in this direction. I think you will see other provinces providing their citizens with what their plan is on how, as we see cases decline in Saskatchewan and across Canada, as we see hospitalizations decline in Saskatchewan and across Canada. I have no doubt that you will see other provinces putting forward what their plan is on living with COVID and taking steps towards getting life back to normal. That will vary given the individual cases, individual situations that we see in various regions of Canada. I would put forward that the federal government also should at some point in time be putting forward what their plan is for the federally regulated industries as well on behalf of Canadians. Not because we should as Canadians know where we are going over the course of the next number of weeks, whether you work in a provincially mandated sectors, which is what we control here today, but also in the federally mandated sectors such as transportation, for example, air travel, things of that nature. And so I think you're going to see other provinces quite likely come forward with what the next number of weeks look like in their respective jurisdictions. And I think in fairness, you'll probably see the federal government as well in the next while come forward with what it looks like for those areas of our communities that are regulated under the federal government. As we know with Omicron, we've been over 20 months, with COVID, not Omicron, but with COVID proper, we've been dealing with this for close to 2 years now. Should things change in 2, 3, 4 months, then ultimately we would have to continue to make the best decisions in light of protecting our healthcare capacity. But for today, where we are with reducing hospitalizations, reducing numbers, we're confident as we move ahead with this phased approach that we are going to take these steps back to normal by reducing and eliminating the public health orders that are in place. But we'd also ask Saskatchewan residents to be gracious and to understand that everyone is doing their own personal risk assessment and they might arrive at a different conclusion than you, and we should accept that and we should respect each and every one for the decisions that they are making in their environment.
You have a follow-up question, Larissa?
Yes, thank you for saying. So you had said in your earlier remarks that part of the reason you were wanting to get rid of this proof of vax policy was that division between having vaxxed and unvaxxed residents and the access that causes. But it is a divisive topic. There are people who have very strong feelings either way about having that policy or not having it. How do you see that the decision being made today to remove that policy at the end of the week to bring people together? It's obviously something that's kind of dividing citizens. Yeah. Just
So so the reason we're able to remove this policy is it's run its course. It has increased our vaccination rates in the province substantially since it was introduced, as we found ourselves in the Delta wave, as we find ourselves in the Omicron wave, which is much more transmissible. The two vaccines do not prevent in any large way the transmissibility of COVID, but it most certainly does help when it comes to the severe outcomes of COVID. So this policy has run its course, and it has enhanced the divisions on whether you are or not vaccinated by saying if you want to go into, let's say, a restaurant, you're going to need a negative test if you're not vaccinated. As we move forward, I would view whether or not you're vaccinated against COVID in very much the same scope as to whether or not you get a flu vaccine each and every year. I don't think getting a flu vaccine is in any way a divisive conversation in the province. I often do, virtually all the time. I do get a flu vaccine simply because I see a lot of people. But I don't talk about that like we have with whether or not we have a COVID vaccine. And so I don't view it as a divisive conversation as we move forward. I view it very much in a similar vein as to whether or not you got a flu vaccine, which seldom, if ever, comes up in anyone's conversation. But that's going to take some effort. That's going to take some individual effort, and I would ask everyone in this province to make that effort. Not focus and judge or in any way concern yourself with who is vaccinated and ultimately who is not vaccinated. Make your own personal risk assessment for you and ultimately your family, and that will be different for different individuals depending on their age, whatever goes into that decision. And I would ask people to do that, and I would also ask them not to in any way judge anyone else for the fact that post-February 28th they may be wearing a mask. That's normalized in our society. It should be accepted. And if someone is making that decision, you may not know the reasons as to why they are making that decision, and I would say that we should respect it.
Next, we'll go to Lynn.
Both you and Dr. Shahab in the past have talked about this, making your personal risk assessment, and you basically just said that people shouldn't ask other people if they're vaccinated or not anymore after this is gone. And we're getting progressively less and less data on COVID-19. How are people supposed to make accurate risk assessments for themselves if they have so little data to go off of?
Do you want to speak to the data first, Dr. Shahab, and then I'll maybe speak to the personal risk assessments and such?
Yeah, so in terms of data, I always used to look at 7-day averages, and we used to get 7-day average data every day, but now I'll only get it on Thursday. So I will only be looking at data for the most part once a week. And I think it is a bit of a different, we need to all get used to it. I think ever since late February, March, we've been looking at data every day, and people who are assembling that data were getting up every day at 3 a.m., starting to assemble that data at 4 a.m. But it was less and less useful on a daily basis. So certainly, I think this Thursday we'll see our first data cut, and it may not be the final format. There will always obviously be some feedback. But I think that will tell us, in general terms, what is the state of Omicron activity in the province. And that will guide us. That'll be one data set that will guide us. But then, many people already have seen in the workplaces, schools, that the Omicron wave came, and in most jurisdictions, most schools, it has visibly passed. As we discussed last week, it has peaked over the last week or two. Hospitalizations are peaking as we speak, or a week or two, and may go up a bit for a week before they start descending. But all of that information will be in that weekly summary that I think will give us better information, which is adjusted to the way Omicron has been behaving. But having said that, I think we need to start visualizing how we will manage ourselves. Obviously starting February 14th. With the proof of vaccination no longer required, but that'll still be available through QR code for travel, and if you're in another country or jurisdiction where it may still be required. And certainly, I think we need to start visualizing that, the current orders for mask use are in place till February. If our trends continue, there will be a time where mask use will not be a mandatory order, and we should start thinking about at work, at school, how, what our decisions would be for ourselves, our children. And again, we have been in that place before several times during the last 25 months now, 26 months, and we will be again. And it's just a matter of, becoming comfortable where we see ourselves in March. But obviously that information will be available on a weekly basis. I think it will be a richer data set given how the reporting had to change with Omicron. But again, let's see on Thursday how it is, and obviously it will continue to get adapted according to what data is more useful.
Which is in many ways, how public health manages many other communicable or transmissible diseases that we have in this province each and every year, and they will use the same alerting mechanisms that they have should a community or for instance, a center or someone have to be alerted in some way, shape, or form. We do this with many other communicable diseases today. Just in your question, Lynn, you had said, should we or should we not be asking people whether or not they're vaccinated? And I have no opinion on that. What I am saying is we shouldn't be, as we move forward and we truly want to get back to normal, we shouldn't be dwelling or focusing in on what other people's decisions are. We each should do our own personal risk assessment as we find our way through the next number of weeks. I would put forward that Saskatchewan people are, in many cases, and families are doing that already. And wherever anyone lands on that, the decisions that they make coming out of that personal risk assessment. It may be wearing a mask to an event. It may be not attending the event. It may be, attending the event, under certain circumstances that their family is comfortable with. What I am saying is we should get back to a time where we were pre-COVID, where we accept the fact that other people are making the decisions they are for themselves and possibly for their family, and we should respect that. When we see people with a mask, it's normalized. We should by no means, whether or not you're wearing a mask or not post February 28th, judge or in any way think that is an issue, that someone is wearing a mask. That's where they have landed for whatever their reasons are with where they feel safe in that particular environment. And we as individuals in Saskatchewan should always accept that. Accept the fact that other people are going to be making their decisions. They may be somewhat different than the decisions we're making, but we respect them for that.
Follow-up question?
Yeah, if I can ask a clarification before my follow-up. You mentioned not wearing masks after February 20th. Is that a for sure that masks are lifting on February 28th then?
Yeah, the public health order around masking will be expiring on February the 28th, and we're not looking at renewing it. So it won't be renewed.
And then my follow-up. On January 12th, Premier, you extended the existing measures to the end of February. And on January 26th, Dr. Shahab said we should stay the course with those existing measures for another 4 to 6 weeks to prevent a rebound of COVID. What's changed since then that we feel we should drop those now and not have a rebound?
I think we're right within that 4 to 6 weeks, maybe a week earlier on the proof of vax, but we're right in the middle of that 4 to 6 weeks. January 26th to February 28th is over 4 weeks. And the proof of vax, I guess we've pulled forward about 2 weeks. And it's the decisions that we've made collectively with respect to where we are, where society is, and ultimately the effectiveness of the public health orders that we have in place, and the tools that Saskatchewan people have in place to utilize in conducting their personal risk assessment each and every day. We have widespread access to vaccines. Among the highest booster dose rate in the country, in particular a very high booster dose rate of uptake in our elderly. We have rapid tests available. We have early intervention therapies that were not available even prior to Christmas in any degree, monoclonal antibodies as well as Paxlovid. All of these are available to ensure that we can, one, move back to a much more normal environment in our daily lives, and two, to ensure that should someone get Omicron, we have the tools available to keep them out of hospital and keep the symptoms as unsevere as possible. What I'm saying here today as well as we find our way through the last of the two public health orders that we have in the month of February is if we truly are to go back to a place where we were in our friend group, in our family groups, in our communities, and in our province 24 months ago, just prior to when COVID hit, we all need to make an extra effort to understand and respect everyone's right to make their own decision.
Next, we'll go to Jeremy.
Yes, thank you. Premier, how much influence did the Convoy protest have on this decision today?
How much which does it have? How much
influence did it have on the decision?
I don't think like there's multiple convoys that are happening in various areas of the province, and you know I think many politicians have spoken to separating out some individuals' comments in each of those convoys from the broader effort and initiative of people that are attending those convoys to have their voice heard like any other protest. And I've been clear around instructing and asking all of them to follow the rules or ultimately face the consequences from law enforcement officials. I think when you look at influence in the decision that the government is making today, there is influence from people across the province. I would say not specifically convoys, but we have a large number of MLAs on the Saskatchewan Party on the governing side, and they have been talking to their constituents throughout this pandemic since the time they've been elected, but have been listening and listening very closely, in particular to changes in trends and reasoning behind. People's comments to their MLA, as well as listening to, we've often talked about the consequences of public health orders, the unintended consequences of public health orders, listening to, families at times very impactful stories around some of those consequences. Ultimately, you blend that with the science that we have. When you look at the Omicron wave being very different than the Delta wave, and I said in my opening comments, we were reluctant to bring in a policy like this because it is a divisive policy. It does segregate people in our communities and in our society. When you look at the effectiveness of that policy, it proved to be very effective in finding our way through the Delta wave, increased our vaccination rates markedly here in the province. As you look at the challenges of transmissibility with the Omicron wave and the case counts that we have, whether they be vaccinated or unvaccinated, this policy most certainly has run its course. And so it's time for us to move to the next steps or the next stage of COVID, and that is one that doesn't include a proof of vaccination policy. So, to answer your question on any convoy, individuals, yes, have an influence as they talk to their respective MLAs. Whether or not they're in a convoy, they're still individuals, and we respect that.
Just a follow-up question. You're talking about division and the division we've been seeing. With your previous, support of these protests, do you think at all you participated in any of this division in the province?
Well, I think, aside from some individuals that have done some really despicable acts, and they should be held accountable for those, the bulk of what you're seeing in not all of these protests, but some of them, and I would go back a couple of weeks to the one in Regina. These are just Saskatchewan people that see the divisions in their family and their friends groups and in their communities, and they're willing to move forward, living with whatever risk is there with COVID, and we're minimizing that by providing the tools for people to use in their personal risk assessment, but they're willing to move forward without the public health orders to move away from some of the the divisions that we ultimately are seeing. And so what Saskatchewan is doing today is providing a plan how we are going to move away from our public health orders over the course of the next about 3 weeks. I suspect you'll see other provinces do something similar in the next while. And I would ask the federal government as well, on behalf of all Canadians, to continually be revisiting any of the orders that they have in place as to their effectiveness and ultimately the other impacts, the other consequences that may be evident from some of those public health orders. I think it's incumbent on all of us as governments to put the public health orders in when they're necessary, and those aren't easy decisions, but we're also incumbent to remove them when they have run their course, and that is what we're seeing here in Saskatchewan.
Go to Connor next.
I believe mandatory self-isolation is attached to the same public health order as masking is. So if that public health order is expiring, is mandatory self-isolation also going to?
Yeah, all of the public health orders will expire on February the 28th. Mandatory self-isolation has not been something that has largely been enforced throughout the COVID pandemic. Started at 14 days, down to 10, and now ultimately at 5. Saskatchewan people, they know what's required of them to find our way back to a normal environment. It involves regular testing, and we have rapid tests available. I did one again early this week. And it involves, when you do test positive, that you isolate yourself for a period of 5 days so that you're not spreading COVID to other people. And it's our expectation that Saskatchewan people are going to continue to do what they've been doing for quite a period of time now. Do you have any other comments on that, Dr. Shaw?
No, I think, the few people who will be going for PCR testing, obviously they'll be in a clinical pathway anyway. And like the Premier said, the vast majority who were either staying home because they were symptomatic and not even accessing rapid antigen testing or accessing rapid antigen, they've been isolating. There's been no notification or enforcement process for that anyways. So, I don't think that order expiring will have any, significant impact. And we have to remember that now COVID will be like, living with COVID means that COVID will be like so many other diseases that we may on occasion get. We stay home if we have a cough or cold or flu. If we have, rarely sometimes, if we have pertussis or measles, there's specific isolation criteria for that, which public health advises. So similar provisions.
Follow-up question, Connor?
Yeah, might be crossing into SHA territory.
Saskatchewan Premier Scott